On the back of strong GDP growth of 8.2%, low inflationary pressure, strong liquidity, and more clarity emerging on the matter of tariffs and trade deals for the life sciences and healthcare industry sectors, at least to the extent it affects our exports and imports, most of the economic factors, rather the macroeconomic factors, seem to be in a very favorable place. In addition, we are currently witnessing great technological advances in areas like AI, in drug discovery, digital healthcare, innovative delivery methods, next-gen therapies, etc., that are making significant advances in this industry faster than ever before, making quality healthcare accessible and affordable to hitherto underserved communities. All of that, coupled with an upcoming patent cliff over the next 4 to 5 years, estimated to be in excess of $250 billion, puts the pharma industry in India on a strong and sustainable growth path. So this is the right juncture to help industry unlock more value with the right policy and regulatory interventions. Some of our suggestions would be, firstly, streamlining the existing regulatory framework through a one regulatory approach. Multiple regulations regulate several licenses and compliances for the pharma and med devices sectors. Due to such multiplicity of regulatory processes and regulators, undertaking operations become complex and time-consuming. In addition, the practice adopted by different regulators for licensing and enforcement may vary in each state. We would request if the government can consider forming a single unified regulatory authority, each for pharma and med devices, with experts from across the sectors on board. This would not only promote ease of doing business through a streamlined regulatory approach, but also boost investment in that sector. Reform the intellectual property landscape in India by further reducing patent approval timelines. The need to reduce the pendency time for a patent approval, currently averaging around 50 months, substantially higher than the global average. By targeting a reduction to approximately 30 months, the government can align India's IP framework more closely with global standards, enhancing its appeal to international pharma companies. Additional incentives on direct taxation front to promote investments in research and development and domestic manufacturing, namely reintroduction of weighted deduction in R&D, relaxation of conditions to avail concessional tax rate on income from patents, revival of the eligibility period for concessional tax rate for new manufacturing domestic companies, etc. And on the GST front, particularly following the GST Reform 2.0 and the consequent reduction in GST rates on various pharma products, which has further skewed the already inverted duty structure, companies are increasingly discharging output tax liability through input tax credit other than cash payment. Consequently, eligible companies are losing out on budgetary support benefits as the scheme currently links support to taxes paid through the cash ledger. We recommend that the government may suitably amend the budgetary support scheme for the eligible refund amount, which currently is limited to GST paid in cash. This amendment would preserve the intended fiscal support for affected industries and promote equitable relief. Overall, we expect strong regulatory and policy boost and sectoral investments in the upcoming budget so that the life sciences and healthcare industry sectors can get the full benefit of the currently favorable macroeconomic indicators and market factors in their journey towards strong, sustained growth for the next 5 years and more.